So this is a short video on the concept of cultural humility. And in particular, we're looking at cultural humility versus the idea of cultural competence. So cultural humility is this idea that we are looking at people and curious about who they are and not assuming that we already know who they are and the story that they tell based on their group affiliation or what we think we know about people like them through stereotypes or other generalizations that we might have. And it was first established as an idea to help people who are social workers or people who are medical professionals work with different diverse populations that they would come in contact with as patients. And the idea of cultural competence is that, I already know everything about you because I know your culture, I know maybe your language, or I know things about your group that make me an authority on who you are as a person. So I am curious about who you are versus I know who you are already is kind of the idea of cultural humility versus cultural competence. And an example of this is this idea of this white nurse from Louisiana who's just accepted a job offer at a hospital in El Paso, Texas. And it's an example of a nurse. And she knows that she's going to have these new patients who are of Mexican descent. She's spent several months reading literature on Mexican culture. She feels really well informed and culturally competent before she begins her new job because she knows all about Mexican people. After a few months of studying Mexican culture and working with Mexican patients, she feels confident about her understanding. And because she knows that, Mexicans are Catholic, then she has a patient that, is in need of some sort of religious direction. And so she asks for a priest for that patient. And she doesn't ask them about whether or not they want a priest. She just asks the priest to come. But she happens to find out that the patient is actually Jewish, and so that the patient feels really offended by her assumption. And that's because she had this idea that she's culturally competent, that she knows this person based on their, group membership and what she feels that group is about. If Lisa took an approach in cultural humility, she wouldn't assume to know everything about people with Mexican cultural backgrounds. She'd ask her patients questions to gain a better understanding of their own personal cultural history, experiences, and beliefs. So back to this idea that cultural humility is all about being curious about other people and understanding where they're coming from, rather than assuming you already know their story and who they are based on stereotypes or generalizations or even things that you've learned about other cultures. Because everyone's story is unique and there isn't a one-size-fits-all for people and who they are. And that's the idea of cultural humility versus cultural competence.